Okay, now let's talk about one rescuer CPR with an AED. First things first, before we even consider using an AED, we need to make sure that our environment is in such a state that we can use an AED. In other words, there's no combustible gases or liquids and no standing water that the body of the patient is laying in. If indeed we are by combustibles or we're in standing water, we would want to move the victim to a place of safety, dry them off so that we could literally use the AED on them. This is specifically important like around drowning patients. The body doesn't have to be completely dry. It's just that we have to make sure that we're not kneeling in a pool of water that the body of the patient is touching. We might suffer electrocution through that or have a shock. So we're in a safe environment. The scene is safe. Our gloves are on. Our CPR shield is available. We start the same way. Sir, are you okay? There's no response. He does not look like he's breathing. I'm going to immediately call for emergency medical services. You, in the plaid shirt, go call 911 and return. I might need your help. Now that emergency medical services or a code has been called, we're going to go right into a pulse check. I check for a carotid pulse for no more than 10 seconds. I do not feel a pulse. The patient is not breathing. Now, we are going to move right to the AED. Turn it on.
This is a training device only. No shock will be delivered.
I like to take the pads out and the scissors.
Remove clothing from person's chest.
If it wasn't already cut, we'd have to cut it or rip it open.
Attach pads firmly to person's chest as shown.
There are diagrams on the pads. It's a nice idea to have a towel to wipe off extra sweat, remove nitroglycerin pads,
Plug-in connector.
or nicotine patches.
Check connector and pads.
Keep in mind that the pads will show you right on them with a diagram as to
Check
where they
connector
go
and
on the
pads.
chest of the patient. So it's pretty simple. This one's going to go up here on the right
Check
top
connector and pads.
pectoralis region. The second one goes mid-axillary, right underneath the armpit on the left
Check
side.
connector and pads.
Make sure the pads are sealed well. The connector only really fits one
Check
way
connector and
on
pads.
most AEDs.
Analyzing rhythm. Everyone stand clear.
I'm not touching the patient. I'm not kneeling on the patient.
Shock advised. Charging. Everyone stand clear.
Make sure everyone's clear.
Every shock delivered. Begin 5 cycles of CPR.
Now I'm going to just do what the prompt tells me to do on the AED. Start my 30 compressions, 2 inches deep or more, at least 100 a minute, and then give my 2 rescue breaths with a head tilt chin lift, using my one-way valve with the mask, and then 30 more compressions. And doing this 30 to 2 until the AED interrupts me, and then it will tell me whether it's going to shock again. I simply follow the prompts as we continue this rescue and wait for emergency response
1
to
minute
arrive.
and 30 seconds of CPR remain.
If for any reason the pads won't stick to the chest anymore, you could remove them and try a new set of pads. However, if they're working, we do not disconnect the AED until advanced life support or the next level of care comes and takes over. That's an important piece to remember as we continue this rescue episode. Sir, are you okay? The scene is safe, my gloves are on, my shield is available. Sir, can you hear me? There's no response. He doesn't seem to be breathing or breathing normally. You, in the plaid shirt, go call 911. Please come back and let me know they're on the way. I don't easily feel a pulse.
This is a training device only. No shock will be delivered. Remove clothing from person's chest. Attach pads firmly to person's chest as shown. Plug-in connector. Check connector and pads. Analyzing rhythm. Everyone stand clear. Shock advised. Charging. Everyone stand clear. Everyone shock delivered. Begin 5 cycles of CPR.
1, 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, and 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, and 3, and 4, and 5, and 6, and 7,
1 minute
8,
and 30
9, 10,
seconds of CPR
13,
remain.
14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28,
1
29,
minute of
30.
CPR remain.
One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
30 seconds
1,
of
2,
CPR
3,
remain.
4, 5, and 6, and 7, and 8, 9, and 10, 11, and 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21.
Analyzing rhythm. Everyone stand clear.
Do not touch patient.
No shock advised. Begin 5 cycles of CPR.
1 and 2.